The most pressing issue, there are many, but the most pressing is healthcare. Without a doubt, the cost of healthcare are a runaway train. When I was elected in 2011, it was about 33% of our budget, which is significant, of course. This year, it'll be about 48%. It's growing at a rate faster than anything else, certainly faster than revenues, and still we have 600,000 people without coverage. And so the real issue is not how much of a commitment we've made to spending money on healthcare. The issue is the cost of healthcare. What is causing the cost of healthcare to continue to skyrocket, and that's what we'll be focusing on.
And what do you believe the reasons for the skyrocketing cost of healthcare are?
There are multiple, but chief among them is the hospital setting. Hospitals have become these giant monopolies and conglomerates, due in part to government regulation that allowed them to have monopolies. In fact, that almost insisted that they be the only hospital in a given area. Over the years, these hospitals have started to acquire doctors' offices around them, diagnostic centers around them. They self-refer to their own diagnostic centers, and they take in patients from these doctors' offices they buy. They, in essence, have created a monopoly. The other issue is the great complication of healthcare makes it to where they can charge anything. And people feel like, well, it must somehow be justifiable. Well, in the large amount of cases, it isn't. It's outright price gouging, and we have to get to the bottom of it.
Okay, so how do you break what you call a monopoly, how do you break that up?
You begin by undoing some of what was done. The issue of certificate of need, or as we know it as CON, is the regulation that says that in order for someone to open a new hospital, there must be considered a need for a hospital. We don't do that anywhere else in our society.
We're here in Miami-Dade County. You're from Miami-Dade County. I see signs all the time. New Mount Sinai medical centers going up all over the county. I think Baptist has done the same thing. I see new medical centers and mini hospitals opening up all around. Are we seeing a reduction in costs as a result?
No, quite the opposite. One of the phenomenons is the standalone emergency rooms. You see them advertised all over the highway. They say emergency, 5-minute wait. Well, I don't know if you've ever been in a real emergency, but you're not hospital shopping at that moment. What they're really doing is that they're having people come in and use these emergency rooms as primary care, and then we're all getting billed for emergency room rates, which of course are astronomical.
Florida has rejected the Medicaid expansion dollars to come into the state. Why not take those dollars that would cover somewhere upwards of 800,000 people and at least give them some health care, take dollars as opposed to turning those dollars away?
Well, I would tell you the level of health care that they will get is minimal because many doctors' offices don't take Medicaid.
Isn't minimal better than nothing?
Well, it depends. If minimal as a Band-Aid today is better than nothing tomorrow when the price continues to skyrocket. See, here's the challenge in the most basic terms. If we were to say that every citizen has a right to a particular item, and we'd say the state should buy this item for you, whatever you want it to be, but that item now begins to go from $100 to $1,000 to $10,000 to $100,000. Your issue is not buying that item for the consumer. Your issue is what is driving up this cost? And the more government money we pour into it, half of our budget now in Florida, the higher the price continues to go. And a Medicaid expansion would do what it did in other states. You would still have a lot of people getting their health care in an emergency room, particularly these standalone emergency rooms that purport themselves to be almost primary care. And you would not have any additional quality. We have to go right at the cost side of this. For decades now, the price has been increasing, and we've kicked the can down the road. It is now half of Florida's budget. We have a commitment to healthcare. We wouldn't spend half our money if we didn't, but we have to stop the cost side of it.